Good morning, dear friends in aesthetic medicine. Because of COVID-19 pandemic, still the world problem. On-site symposium as we had in the first years is not advisable. So the sixth ABLS in AEC Symposium is organized online using Zoom facility. This year's theme is Best Mindset in Aesthetic Medicine. The aim is to inform you all that our existence as aesthetic medical practitioners is a unique medical specialty. We are not an appendix to dermatology or plastic surgery. Our specialty is aesthetic medicine, which is a combination of arts and science. Secondly, Renovia ABLS Academy would like to emphasize the artistic way of thinking in doing aesthetic medical procedures. The way of an artist is touch and feel the beauty being created to our clients. We need to see and appreciate beauty in each client before we crafting beauty on her or him. We are aware and beware of complications as we walk through each procedure. Seeing beauty immediately after each strike is an essential part of best mindset in aesthetic medicine. Let's enjoy the symposium presentation. The first session will be on aesthetic ultrasound, which is a non-surgical procedure. The International Society of Aesthetic and Plastic Surgery defines a non-surgical cosmetic procedures as an effective and safe procedure for those who are willing to undergo subtle enhancement and surgical result enhancement with lower recovery periods. Non-surgical procedures help to correct facial lines, wrinkles, cellulite reduction, and unwanted fat reduction with minimal side effects. It is the world trend that non-surgical procedure will override surgical market. Research in marketing showed that the global medical aesthetic market from 2021 to 2028 is projected to reach $16 billion by 2028 from $7 billion in 2021. The compound annual growth rate CAGR is 12.5%. In 2019, U.S. statistics shows increased numbers of Botox injection, filler injection, and laser hair removal. For surgical procedures, eyelid surgery and abdominoplasty increased in number as well. Yet the total number of non-surgical procedures is 4 to 5 times higher than the number of surgical ones. Benefits of looking younger. Studies showed similar results for both overall perceived attractiveness and attractiveness of specific body parts. Researchers also found a strong link between perceived self-attractiveness and life satisfaction in women. Looking younger has health benefits, particularly in health. Feeling younger is something that has enormous effect in helping people handle stress, including financial stress, cope with depression and loneliness, and greater sexual satisfaction. Looking younger and thinking more positively about the future correlated with lower mortality. So by looking younger, you may actually live longer. Looking younger is a natural desire, just like it is natural to seek a younger spouse after a certain age. It is a desire to maintain reproductive viability. Simply looking younger is not enough. we still need to invest more efforts into aging and longevity biotechnologically. Helping people to live longer and more productive lives remains one of the most significant medical challenges imaginable. When skin ages, the collagen and elastin in the skin begin to break down, which results in loss of elasticity and volume. This can clinically translate into wrinkles, irregular texture, laxity, and an overall aged appearance. The gold standard for energy-based treatment was the use of ablative technology, whether full-field or fractional, that removes a volume of tissue plus coagulation of an area around the ablated area that is replaced with healthier, younger-looking tissue. However, the downtime and risks associated with ablative technologies are not always acceptable to the vast majority of patients and physicians. In addition, as patients and indications have expanded to those who are younger and with less skin damage to treat, ablative technologies can be overkill for many patients. So more people are looking for non-ablative or non-surgical procedures these days. The aim of non-surgical facial skin tightening and lifting is collagen remodeling and collagenesis. Studies have shown that the mechanism of non-surgical skin tightening and lifting is immediate collagen contraction and delayed matrix remodeling. Mark L. Jewell and Charles Desilets, in their research paper, The Evaluation of a Novel High-Intensity Focused Ultrasound Device, Clinical Studies in a Posi model, published in Aesthetic Surgery Journal of the American Society of Aesthetic Plastic Surgery in 2011. They used thermocouples into pig skin tissue to record temperature before, during, and after HIFU treatment at the skin surface, focal zone, and surrounding tissue. Figure 1 demonstrated that the temperature at the focal zone approached 70 degrees Celsius for 1 to 2 seconds, which is sufficient for producing tissue necrosis, and then quickly decreased. The temperature within the tissue surrounding the focal zone rose to non-lethal levels, while the temperature at the skin surface remained unchanged. Immediately following HIFU treatment, there is mild ecchymosis seen in the zone treated. Following treatment, nerves appear intact. Extracellular lipid vacuoles are seen from the ablated adipocytes. An intact arteriole that passes through the treatment zone is noted in this gross specimen. Evidence of mild tissue hemorrhage within the treatment zone is noted. Collagen fibers within the treatment zone show evidence of heat-induced contraction and remodeling from the thermal HIFU. Since both the degree of collagen shrinkage and the decrease in single harmonic generation intensity show a dependence on duration of thermal treatment from 0 to 9 minutes. There may be a correlation between collagen shrinkage and single harmonic generation intensities, as in Figure 5 shows the association of collagen shrinkage and single harmonic generation intensity during thermal treatment at 58 degrees Celsius for up to 15 minutes, and a linear regression is calculated. In aesthetic ultrasound, uses sound energy of 4 MHz to 10 MHz. In medicine, the intention of a high-intensity focused ultrasound HIFU treatment is to raise the temperature of a selected isolated tissue volume above 55 degrees Celsius and to maintain this temperature for 1 second or longer. It is known that 55 degrees Celsius held for this time will lead to coagulative necrosis and immediate cell death, as reported by Saparetto et al. In the Thermal Dose Determination in Cancer Treatment Therapy, published in the British Journal Radiation Oncology, Biological Physics Medicine in 1984. Ultrasound beam delivery system. HIFU equipment consists of two main components. The first is a piezoelectric ultrasound transducer that is used to deliver the therapeutic ultrasound beam. The most popular type of transducer used is a concave focusing transducer with a fixed aperture and a focal length, as in Figure 2a. Other types of transducers include phase array transducers, which comprise multiple piston transducers that are arranged on the truncated surface of a spherical bowl, Figure 2b, or a flat transducer fully populated phased array, Figure 2c, that is model JC HIFU system, Chongqing HIFU Company, Chongqing, China. The mechanical movement of the transducer determines the position of the focal point with electronic steering of the ultrasound beam, allowing fine control of the focal point's spot location. Ultrapi is the first FDA-cleared non-invasive microfocus ultrasound procedures that lifts the neck, chin, and brow and improves lines and wrinkles on the upper chest.
With age, skin loses its elasticity and the signs of aging become more visible. Beneath the skin's surface, structural proteins such as collagen decrease over time. This leads to a decrease in skin's elasticity and contributes to sagging and the forming of wrinkles. Ultherapy is a non-invasive way to lift and tighten skin using time-tested ultrasound technology and is US FDA cleared and EU CE mark certified. Using microfocused ultrasound along with its proprietary deep sea ultrasound visualization, Ultherapy delivers energy to where it will be most beneficial, leading to a lift and tightening of the face, neck and décolletage. Ultherapy reaches the same deep tissue layer as surgical facelift addresses, but without surgery or downtime. During an Ultherapy treatment, ultrasound waves are microfocused at precise depths in the dermis and hypodermis, sparing the skin surface and intervening tissue. Friction heats the tissue to between 60 and 70 degrees Celsius. forming thermal coagulation points at depths of 1.5, 3 or 4.5 millimeters. Delivery of ultrasound energy in this manner causes contraction and denaturation of collagen and initiates the body's healing response, resulting in collagen and elastin synthesis and tissue repair. This new collagen growth leads to skin lifting and tightening that gradually takes place over time, with visible improvements that can even be seen a year after treatment. ULT therapy is scientifically proven to stimulate new collagen and elastin, which can reverse the signs of aging in the face, neck and décolletage.
In 2021, Sofwave Medical, an Israel-based company, introduced a new non-invasive, minimal downtime approach to improving facial lines and wrinkles. Superb synchronous ultrasound parallel beam technology with integrated cooling enables treatment at the mid-dermis while ensuring no damage to the epidermis or to the underlying structures beneath the dermis. Sofwave's breakthrough technology can position your practice at the forefront of innovation with smart yet simple, effective and safe aesthetic solutions for patients. With its multiple ultrasound beams deliver energy simultaneously to coagulate more tissue area more quickly at the depth of 1.5 mm mid-dermis that achieves beneficial effects with minimum penetration in 30 to 45 minutes treatment time. Who is Sofwave? Sofwave is an emerging leader of energy-based non-invasive skin treatment aesthetic medical devices. The company is one of the only companies in the field of aesthetic medicine that is listed on Tel Aviv Stock Exchange. The company has developed synchronous ultrasound parallel beam technology, Superb, which provides a reduction in fine lines and wrinkles and restoration of skin features and revitalizes collagen. Sofwave's product is FDA cleared and has the EU CE mark with sale across the global markets. On Wednesday, May 26, 2021, the company made its initial public offering IPO on the Tel Aviv Stock Exchange and managed to raise $50 million at a pre-money valuation of $200 million. The IPO was led by Barak Capital underwriters. The core technology is its fan parallel beam geometry of high-intensity, high-frequency ultrasound beam array, parallel delivery of multiple 7 low divergence ultrasound beams with low sensitivity to tissue inhomogeneity, ensuring repeatable and controllable energy deposition in the skin. High-density uniform deposition of full energy at 1.5 mm mid-dermis via direct contact, targeting the effect in the mid-dermis and ensuring no damage to the underlying structures, bone, facial nerves, facial fat, and blood vessels. Soft cool, active integrated cooling with real-time skin temperature monitoring mechanism for optional epidermal protection and accurate targeting of the thermal effect while managing treatment comfort. Treatment of all skin type, large coverage with each pulse and unique fractional impact to mid-dermis. Sofwave's state-of-the-art synchronous ultrasound parallel beam technology, superb, a game changer, addresses the growing demand for non-invasive treatments that deliver noticeable wrinkle reduction. Preclinical trials demonstrated a clear tissue effect with optimal safety. The majority of patients were marked as improved to very much improved following a single treatment session only. 72% of subjects satisfied self-rated improved to very good improve on Guy's scale for a single treatment protocol. But how does HIFU work? Aesthetic HIFU works on the two mechanisms, the thermal energy effect and the cavitation effect on the target tissue, which cause immediate collagen contraction and delayed matrix remodeling. The use of high-intensity focused ultrasound HIFU is based on three important capabilities of ultrasound. First, focusing the ultrasound beam to produce highly localized energy deposition. Secondly, controlling the location and size of the focus zone. And thirdly, using intensity sufficient to destroy tissue at the focus zone. Electric energy is converted into ultrasonic vibratory energy of water in the cartridges, causing intense friction vibrations between targeted tissue molecules. Thermal injury is then produced. Protein denaturation begins to occur at a temperature of 40 degrees Celsius. Coagulation necrosis is observed at a temperature of 60 to 70 degrees Celsius. At 100 degrees Celsius, histologic water starts to boil. Microbubbles are formed. Ultrasound waves produce expansion and collapse of stream bubble. With high and prolonged delivery of ultrasound energy, microbubbles accumulate, forming macrobubbles and explode, making shock waves. Shock waves produce high temperature up to 5,000 degrees Celsius and causes mechanical injury. What is needed in ultrasound energy is thermal injury only. Clinical application of ultrasound emphasizes its thermal effect, which causes immediate result of collagen contraction. Aesthetic physicians must be able to recognize the clinical effective signs of HIFU produced by its immediate effect of the treated area. They are immediate skin tightening and lifting, minimum pain or heaviness or mild numbness feeling of the face, the early complication sign that should warn the physician of incoming complications is mild skin erythema. The delayed effect of HIFU is the result of matrix remodeling, which may be observed after 3 to 4 weeks and may last up to 3 to 6 months or more. There may be reduced jaw, increased jawline definition, tightening of neck, lifted eyebrow, and V-shaped face. The research paper of Stephen P. Ivanko et al. In a role for hyaluronic and proteoglycan-linked protein during phenotypic modulation of human lung fibroblasts in vitro, published in the Journal of Histochemistry and Cytochemistry in 2020, volume 68, found that physical changes in skin are among the most visible signs of aging. They found that young dermal fibroblasts secrete high levels of extracellular matrix constituents, including proteoglycans, glycoproteins, and cartilage-linking proteins. The most abundantly secreted was SAPLN1, a hyaluronic and proteoglycan-linked protein. HAPLN1 was lost in aged fibroblasts, resulting in a more aligned ECM that promoted metastasis of melanoma cells. Reconstituting HAPLN1 inhibited metastasis in an aged microenvironment in 3D skin reconstruction models and in vitro. Intriguingly, aged fibroblast-derived matrices had the opposite effect on the migration of T cells, inhibiting their motility. HAPLN1 treatment of aged fibroblasts restored motility of mononuclear immune cells while impeding that of polymorphonuclear immune cells, which in turn affected regulatory T cell recruitment. This data suggests that although age-related physical changes in the ECM can promote tumor cell motility, they may adversely affect the motility of some immune cells, resulting in an overall change in the immune microenvironment. Understanding the physical changes in aging skin may provide avenues for more effective therapy for older patients with melanoma. Dr. Thirarak Siddhichai-Viset from APAS Clinic is going to share her experience in using Ultraformer microfocus ultrasound for facelift. Ultraformer is a microfocus ultrasound just like Ultra. And later, Dr. Apichaya Sienglucha from Gracia, the private clinic, will demonstrate her technique in using generic HIFU for facelift too. The aim of these two demonstrations is to emphasize clinical effective signs to ensure effectiveness and to avoid complications.
ค่ะวันนี้นะคะเราก็จะมาทำเครื่องอัลตราซาวด์กันนะคะซึ่งหลักการนะคะก็จะเป็น MFU นะคะไมโครแล้วก็แมคโครโฟกัสอัลตราซาวด์นะคะตอนแรกนะคะอันดับแรกที่เราจะทำเนี่ยก็จะเป็นมาร์คตำแหน่งนะคะเพื่อดูว่าเราจะทำถึงจุดไหนสแนสอยู่ตรงไหนนะคะหัวแรกที่เราแคปเทรดแรกที่เราจะทำเนี่ยก็จะเป็นหัว 4.5 มิลลิเมตรนะคะก็จะลงลึกได้ถึงชั้นสแลนชิวนะคะหลังจากนั้นเราก็เริ่มกันเลยนะคะก็จะมีการแฟคชั่นสกินก่อนเล็กน้อยนะคะแล้วหลังจากนั้นนะคะก็จะลองเทสนะคะอันนี้พลังงานที่ใช้นะคะก็จะประมาณ 0.9 ค่ะปกติค่ะในแต่ละรายที่จะทำนะคะ ก็จะเป็นไมโครโฟกัสนะคะจะค่อยๆทำไปเรื่อยๆนะคะขยับทีละนิดนะคะแล้วก็อาจจะทำตามเลเตอร์ของคนไข้แล้วก็ดูว่าความหย่อนคล้อยของคนไข้อยู่ประมาณไหนก็อาจจะประเมินนะคะส่วนใหญ่ก็จะใช้เจลปริมาณพอดีนะคะแล้วก็แนบไปกับสกินนะคะจุดบริเวณที่เราจะเว้นนะคะก็จะเป็นแถวนาโซเลเยโฟนะคะที่มีเนื้อค่อนข้างเยอะค่ะถ้าไม่งั้นนะคะก็อาจจะเกิดอาการปากเบี้ยวได้นะคะแต่มันจะเป็นอยู่ชั่วคราวค่ะเราจะค่อยๆดีขึ้นแต่จากประสบการณ์นะคะจากเครื่องอัลตราซาวด์เนี่ยค่ะก็จะไม่ค่อยเจอค่ะส่วนใหญ่ก็จะเห็นผลทันทีประมาณสัก 10-20% นะคะอาจจะมีส่วนน้อย 5-10% นะคะที่อาจจะมีอาการบวมเล็กน้อยนะคะแต่ส่วนใหญ่ก็จะไม่ค่อยบวมนะคะส่วนใหญ่ก็จะประมาณสัก20 รายในแต่ละช่องนะคะหลังจากนั้นที่เราทำด้านนี้แล้วหลังจากนั้นก็จะเป็นดึงด้านข้างขึ้นด้านบนนะคะก็จะมีการ traction skin นะคะแล้วก็ดึงขึ้นจะค่อยๆเรียงลำดับความลึกนะคะก็จะใช้ในหัว 4.5 ก่อนแล้วต่อด้วย 3 แล้วก็ 2 มิลลิเมตรก็ส่วนใหญ่ก็จะเอาที่คนไข้พอไหวค่ะก็จะไม่เจ็บเยอะเกินไม่เจ็บมากจนเกินไปนะคะก็จะรู้สึกเล็กน้อยส่วนใหญ่ก็จะรู้สึกเยอะเนี่ยในหัวที่เป็น 4.5 ค่ะหลังจากที่ทำหัว 4.5 ไปแล้วนะคะต่อไปก็จะเป็นหัว 3 นะคะส่วนใหญ่นะคะหัว 3 ก็จะใช้พลังงานประมาณสัก 0.5 ค่ะหรือในบางทีนะคะที่มีพลังงานเยอะหน่อยก็สามารถเพิ่มได้ค่ะหัว 3 ก็จะเพิ่มขึ้นนะคะแล้วก็หัว 2 นะคะแล้วก็จะเป็นหัวสุดท้ายนะคะอันนี้ก็จะเป็นหลักการของแมคโครโฟกัสอัลตราซาวด์นะคะคือพลังงานก็จะเกิดขึ้น8 เท่านะคะถ้าใช้ในการเก็บบริเวณที่ต้องเข้าเพียงจุดเล็กๆนะคะเนื่องจากขนาดของหัวค่ะจะขนาดเล็กกว่าจึงสามารถเข้าได้ดีบริเวณใต้ตาแล้วก็ใช้สำหรับเด็กของการมองค่ะอันนี้หลังจากลองทำไปครึ่งหน้านะคะใช้ประมาณ120ช็อตนะคะก็จะเห็นว่าร่องแก้มนะคะดูดีขึ้นตรงนี้ดูดีขึ้นนะคะแต่จริงๆยังไงเนี่ยค่ะก็ต้องรอผลประมาณ 1-3 เดือนนะคะรอให้กระตุ้นการสร้างคอลลาเจนเต็มที่ค่ะ
For this patient, you can appreciate that there is a sagging at the mouth, corner of the mouth, and also the cheek, and a bit under chin. Because it's not, there is not much fat accumulation, so I will lift just the deep collagen. So I choose 4.5 mm. You have to move just a little bit between the shot, and during one shot that you make, you have to quite steady, not moving the skin, and maintain the full contact of the handpiece and the skin. I'm not using high energy, but I'm going to use high repetition in optimum energy.
To recapitulate, Reneware ABLS Academy mentoring principle is to train students to perceive clinical effective signs that happen immediately after each application of energy to client skin, and to be able to detect early complications before serious ones occur. For HIFU, clinical effective signs are immediate skin tightening and lifting, jawline definition, feeling numbness or heaviness or tiredness of the face. For early complications, signs are intolerable pain and mild erythema.